Understanding your menstrual cycle is a crucial step whether you're trying to conceive or looking to avoid pregnancy naturally. Knowing when you're fertile, when you ovulate, and which days are considered safe can help you make informed decisions about your reproductive health. Let's explore how to calculate your fertile days, identify your ovulation day, and determine your safe days step by step. First, let's establish the basics of the menstrual cycle. The menstrual cycle is the monthly series of changes a woman's body goes through in preparation for the possibility of pregnancy. The cycle begins on the first day of your period and ends the day before your next period starts. On average, a menstrual cycle lasts about 28 days, but cycles ranging from 21 to 35 days are considered normal. Every woman's cycle is unique, and it's important to track your own pattern to understand how your body works. To start, you'll need to track your menstrual cycle for at least 3 to 6 months. Mark the first day you start bleeding. This is considered day 1 of your cycle. Count each day until your next period starts. If you do this for several months, you'll get a sense of your average cycle length. For example, if your period starts on May 1st and your next period begins on May 29th, your cycle length is 28 days. Now, let's talk about ovulation, which is when an egg is released from the ovary and is available to be fertilized. Ovulation typically occurs about 14 days before your next period, regardless of your cycle's length. This means that if you have a 28-day cycle, ovulation is likely to occur around day 14. If your cycle is longer or shorter, you'll need to adjust accordingly. For example, if your cycle is 32 days, subtract 14 from 32, which gives you 18. In this case, ovulation would likely happen around day 18 of your cycle. If your cycle is 25 days, ovulation would be around day 11. Remember, this is just an estimate. Cycles can vary, and ovulation can shift due to stress, illness, or other factors. The fertile window is the period during which you are most likely to get pregnant. Sperm can live inside the female reproductive tract for up to 5 days, and the egg is viable for about 12 to 24 hours after ovulation. This means your fertile window is typically the 5 days leading up to ovulation, the day of ovulation itself, and possibly the day after ovulation. In other words, your fertile window is about 6 to 7 days long each cycle. Let's break down how you can calculate your fertile days. 1. Track your cycle. As mentioned earlier, record the first day of your period and count the number of days until your next period. Do this for several months to determine your average cycle length. 2. Estimate ovulation. Subtract 14 from your average cycle length. For example, if your cycle is 28 days, ovulation is likely around day 14. 3. Identify the fertile window. Sperm can survive for up to 5 days, so count back 5 days from your ovulation day. Your fertile window would be from day 9 to day 14 in a 28-day cycle. To illustrate, let's say you have a 30-day cycle. Subtract 14, which gives you 16. You're likely to ovulate around day 16. Your fertile window would be from day 11, 16 minus 5, to day 16. If you have intercourse during these days, your chances of getting pregnant are highest. It's important to note that these calculations are estimates. Many factors, including stress, illness, travel, and medication, can affect your cycle and ovulation. That's why it's beneficial to monitor your body for signs of ovulation. There are several ways to detect ovulation. Basal body temperature, BBT. Your body's resting temperature rises slightly after ovulation. By taking your temperature every morning before getting out of bed and charting it, you can notice a pattern. A sustained rise in temperature typically indicates that ovulation has occurred. Cervical mucus. Around ovulation, your cervical mucus becomes clear, stretchy, and slippery, much like raw egg whites. This type of mucus helps sperm travel through the cervix to meet the egg. Ovulation predictor kits, OPKs. These are over-the-counter urine tests that detect the surge of luteinizing hormone, LH, that occurs just before ovulation. Physical signs. Some women experience mild pelvic pain, known as Mittelschmerz, or notice changes in libido or breast tenderness around ovulation. Now, let's discuss safe days, days when you're least likely to get pregnant. These are generally considered to be the days outside of your fertile window. The safe period is usually the days just after your period ends and the days after ovulation until your next period begins. However, it's important to understand that this method is not foolproof. Sperm can survive for several days, and cycles can vary, making it possible to ovulate earlier or later than expected. That's why using the calendar method alone is less effective than combining it with other fertility awareness methods. To calculate your safe days: 1. Determine the length of your shortest and longest cycles. Over several months, note the shortest and longest cycles you've had. 2. Calculate the first fertile day. Subtract 18 from the length of your shortest cycle. For example, if your shortest cycle is 26 days, 26 minus 18 equals 8. This means day 8 is the first potentially fertile day. 3. Calculate the last fertile day. Subtract 11 from the length of your longest cycle. If your longest cycle is 32 days, 32 minus 11 equals 21. This means day 21 is the last potentially fertile day. In this scenario, days 8 through 21 are considered fertile, and the days before day 8 and after day 21 are your safe days. Remember, this is a general guideline and should be used in conjunction with other fertility awareness methods for better accuracy. If you're trying to conceive, have intercourse during your fertile window, especially the 2 days leading up to and including ovulation. If you're trying to avoid pregnancy, it's important to abstain from sex or use another form of contraception during your fertile window. There are several fertility awareness methods, including the calendar method, tracking your cycle as described; the basal body temperature method, charting your daily temperature to pinpoint ovulation; the cervical mucus method, observing changes in cervical mucus to identify fertile days; the symptothermal method, combining temperature, mucus, and physical symptoms for a more comprehensive approach. It's important to remember that while fertility awareness can be effective when used correctly and consistently, it requires commitment and careful tracking. It may not be the best option for everyone, especially those with irregular cycles. For those with irregular cycles, predicting ovulation can be more challenging. In such cases, using ovulation predictor kits, monitoring cervical mucus, and tracking physical symptoms can be especially helpful. Let's recap the key steps. 1. Track your periods for several months to understand your average cycle length. 2. Estimate your ovulation day by subtracting 14 from your average cycle length. 3. Identify your fertile window, the 5 days before ovulation, the day of ovulation, and possibly the day after. 4. Use fertility awareness methods to confirm ovulation and better understand your body's patterns. 5. To avoid pregnancy, abstain from sex or use contraception during your fertile window. To conceive, aim for intercourse during the fertile window. Be aware that fertility awareness methods are most effective when used correctly and consistently. They do not protect against sexually transmitted infections and may not be as reliable as other forms of contraception. If you're seeking to conceive and have tried tracking your cycle without success for several months, consider consulting a healthcare provider. If you're using fertility awareness to avoid pregnancy, educate yourself thoroughly and consider combining methods for greater effectiveness. Understanding your cycle empowers you to make informed decisions about your reproductive health. Whether you're planning for a family or looking for natural ways to prevent pregnancy, knowing your fertile days, ovulation day, and safe days gives you greater control and confidence. Remember, every woman's body is unique. Be patient with yourself as you learn more about your cycle, and don't hesitate to seek support from healthcare professionals if you have questions or concerns. With knowledge, consistency, and attention to your body's signals, you can navigate your fertility journey with clarity and assurance.